Okay, let's have a discussion on blood pressure. So blood pressure is made out of 3 different components, and we can divide these components like this. So the first component here is cardiac output, total peripheral resistance, and cardiac output is made out of 2 separate components as well: stroke volume, heart rate. So the way that I like to think about blood pressure is equal to stroke volume times the heart rate times the total peripheral resistance. And blood pressure can be further divided up into systolic over diastolic pressure. The systolic pressure originates from the pumping action of the heart, and the diastolic pressure, this pressure is generated by the rebound of the aorta. So if we assume our prototypical blood pressure is going to be 120 over 80, and we'll discuss this a little bit further. So what are these 3 different components? Well, we'll start off with the easiest one, heart rate. So heart rate is just going to be number of beats per minute. So this is beats per minute. Stroke volume is the amount of blood per cardiac cycle that the heart moves. So this will be measured in milliliters. And so if we take cardiac output is going to be stroke volume times heart rate. So we can say it's mils per minute. Okay? Milliliters per minute. And since we're going to be talking about it in a minute basis, it's better to make this into liters per minute of cardiac output. Okay. Let's talk about systolic and diastolic again. So the systolic pressure, so whenever we have a pressure, you can think about pressure in terms of the pressure they have, say, in the tire of your car. And that pressure is going to increase or decrease with the different conditions. So when the car is moving, the tire is rolling, there's additional pressure as opposed to when the car's at rest. So let's talk about the systolic pressure. So every single time the left ventricle, so we're talking about the left side of the heart, every single time the left ventricle pumps, it's going to force blood. So if this is the left ventricle, this is the aortic valve. So every time this left ventricle pumps and squeezes, it's going to force blood into the aorta. And this, eventually, we measure blood pressure on the arm in the brachial vein. In the brachial vein, we can measure this pressure that this left ventricle is generating. Okay, so systole is during the contraction of the left ventricle. That's the pressure that we measure out here. Now, in diastole, the aortic valve closes. So when the valve is closed, you'll still have blood in the aorta. And now this blood is not connected to the heart anymore because this is a closed system now because the aortic valve is closed. So this aorta rapidly expanded during systole, and in diastole it's going to come back and it's going to rebound and it's going to push in, it's going to squeeze the blood inside the aorta itself. So that squeeze, we call it the rebound of the aorta. That's what generates this pressure here. So in pathological conditions, so for example, if we have aortic regurgitation or aortic insufficiency, where this valve is leaky and you have blood that leaks back into the left ventricle, well, this aorta can't make as high of a diastolic pressure because that pressure that's generating is going to push some blood back into the left ventricle. So in aortic regurg, we'll have a normal systolic blood pressure, but your diastolic pressure will be very low. So for example, in aortic regurgitation, you might see a blood pressure in your test question, 120 over 40. And so the second you see that, you know right away that that's aortic regurgitation. There's another term that they like to use. It's called systolic minus diastolic. This is equal to the pulse pressure. So aortic regurgitation, you have an elevated pulse pressure. Okay. Now let's go back to our discussion over here. So we had stroke volume, heart rate, total peripheral resistance. So what determines each of these 3 conditions? There's 3 determinants of stroke volume that you have to know about. The heart rate is determined by the parasympathetic and sympathetic input going to the heart, and if we were to cut the nerves, cut the sympathetic nerves, and cut the parasympathetic nerves, what would the heart rate be at? Well, the heart rate is controlled by the SA node, and the SA node likes to beat at a rate of 100 per minute. That's its baseline. And usually in our bodies we have more parasympathetic input to the heart, causing the heart rate to be lower, say for example 70. Total peripheral resistance is the resistance, sometimes we call this systemic vascular resistance, both terms are the same thing. This is the resistance in the blood vessel. So as we talked about over here, when the heart pumps into the aorta, there's a resistance preventing blood from going, and that resistance is found in the arterioles. So you have many small arteries, can call them arterioles, and depending on if they're big or small, you'll have more or less resistance. So that's determined by the arterioles and whether they're contracted or dilated. Okay, let's come back to stroke volume. So what are the three determinants of stroke volume? Well, simply it's preload, afterload, and contractility. And between these three, we can increase one, decrease the other, and all three of these will affect the stroke volume. And if you recall, the stroke volume is how many milliliters that we're pumping in each cardiac cycle. The thing to remember about stroke volume is increasing any of these. So if I increase preload, I will increase the stroke volume. So increasing preload will increase the stroke volume. If I increase afterload, that will decrease the stroke volume. If I increase contractility, that will also increase the stroke volume. Okay? And we'll talk about these three conditions in the next video.